It's time to get your medical questions answered.
The number to call is 608-270-9933. Dr. Zorba Paster is here. Welcome.
Good to be here.
Good to see you. Call in now. We're hearing reports that this could be one of the hottest summers in the history of the globe.
Right, right.
And heat kills more people than any other weather.
You know, we think that people freeze to death. They're outside, they freeze to death, but in fact, more people die of heat than anything else. And years ago in Chicago, 1,000 people in the middle of the summer died of heat. So we've got to think about, especially if you've got any medical problems, chronic lung disease, heart disease, what you're going to do.
And then you mentioned heart, lung disease, and we got the smoke coming back in again.
Right.
So it's like a twofer we've got going on.
So I think it's really important if you have medical problems, it's important to make sure you stay inside. This is not a good time to be outside. Turn on the air conditioner, make sure it's nice and cold, and make sure it basically has a good filter on it to get rid of all the smoke that's in the environment. Those are important things to do.
Yeah, you should change your filter on your, if you have central air conditioning, because all that smoke. I took mine, I was black.
That's exactly what I did. We had some trouble with our air conditioner. We I took it out. We had somebody who actually came and fixed the air conditioner. He took out the basically the filter, and he said, "Look at this." And I said, "Oh my God, I didn't realize how much junk is caught in the filter." But it's a filter. How could I not realize that? That's what it's for.
But it's mostly from the smoke.
It's mostly from the smoke. And the reason why it wasn't changed is I'm lazy. I just didn't change it. It's laziness. So it's important if you've got lung problems to make
What are some danger signs if you're suffering from heat exhaustion or stroke?
Shortness of breath. You feel like you're not getting enough breath into your body. That's usually the first thing that hits you. Other things that will generally hit you besides that will be the fact that your heart will be racing and you feel fatigued and tired. And if so, that's the time to call someone who you love, or make sure you get in contact with your primary care provider. It's important, but air conditioning is really the key. A fan doesn't do it. You may feel better with a fan, but it's not as good for your lungs.
So what if you are caring for somebody who cannot tell you how they are feeling?
Oh, that's
what
the
are
hard
you supposed
Isn't
to
that
be?
part?
Yeah.
Ask them questions. That's kind of the best way to do it. Say, how are you feeling? Then you go, how are you really feeling? And you know, if you're not sure, eyeball them. In other words, go to their house and see what they're doing. Do not depend on the phone. Do not depend on Zoom. But actually, especially if you're in the same town, go and see them. You can do more by seeing somebody in the house and convince them to do things than you often can do on the phone. I mean, you know, that's the way humans are. We like to be in close contact with one another.
Let's talk about this new over-the-counter birth control.
Oh, it's wonderful.
pill.
It's wonderful. Oh, the over-the-counter birth control. So birth control pills in Europe are available over-the-counter. And finally, birth control pills are going to be available after the first of the year over-the-counter. They're just as effective as birth controls that you need with a prescription. And that's because right now you do not have to have a Pap test. You used to have a Pap test and an HPV test before you got birth control pills. Now you don't have to have a Pap test or HPV test before you're 21 or 25, depending on which organization is actually right. They're sort of duking it out. But this is very important because when birth control is available to young people, you reduce the number of unwanted pregnancies. It is a major step forward. So in that aisle in the drugstore, you'll not just have condoms, you'll not have diaphragm, you'll not just have spermicides, but you'll have birth control. And that's critically important.
Okay, now I have to ask again. It really is as effective as over-the-counter versus something you get from the pharmacy.
The whole issue with birth control pills, they should be taken at the same time every single day. So if you're taking it at 10 o'clock in the evening, you take it at 10 o'clock in the evening every single day. And that's why we invented iWatches and others. They have alarm. Take your pill. You take your pill and you make sure you do it every day. The answer is yes. It's just as effective, and birth control pills taken correctly are somewhere in the 98 to 99% effective rate, and so important. Once we reduce unwanted birth control, we reduce a lot, and we really help our society.
We have time for one quick call here. Chris from Sauk City, what's your question, Chris?
What do you do when you don't have air conditioning in your house?
Well, that's a big issue. In a time like this where it's super hot, you try to depend on somebody else who does have air conditioning in their house. And you say, can I go to your house and can I stay for the day? It's 85 degrees, 88 degrees outside, and it's a big problem. And you're right. And that's why some of the shelters are opened up in cities to basically help people, because not everyone has air conditioning. Not everyone can afford air conditioning. It is a big issue.
Oh, public library, other public buildings.
Public libraries. All the public
mall.
buildings have them, right, and the malls, of course.
All right. We are out of time, unfortunately, for that caller we didn't get to.
I know, I apologize.
Zorba, thank you.
A pleasure to be here.
Okay.
See you